Hi, I am CJ Devgan, and welcome to another edition of Breaking Barriers, where my goal is to provide you with proven tools to help you transform your business. We are living in times where business, as usual, is not sustainable. Because new disruptors are arriving every day, therefore, you too must reinvent and break barriers that are holding you back. If you are struggling to grow your business, check out my website at cjdevgan.com and learn about my consulting and coaching services, and let's talk.
Hello and welcome to another episode of Breaking Barrier. My guest today is Dr. Mazin Ghadir. Dr. Ghadir is a director at IQVIA Peer Provider Government Management Consulting. He is also an external advisor at the Executive Office for Organizational Transformation at Dubai Health Authority with responsibility for health strategy development, implementation, execution, and transformation. Welcome, Dr. Ghadir. Anything else you would like to add at this time?
No, thank you so much. I think today I'm going to be sharing my own thoughts and from the experience that I had in being in the digital health space for the last 20 years. So my opinions and answers represent my experience. That's all that I want
Absolutely,
to add.
absolutely. This is an individual experiences that you have. And again, as I mentioned earlier, I'm season three is more on transformation. First few episodes is a series on change management, and I'm going to do series on healthcare changes that are coming and are required because of the changing landscape and the challenges that we all are encountering, regardless of whether we are in Canada or UAE or US or India or any other part. And what I want to see is, are there any common challenges that global community is encountering, and what are their call to actions, and how are we as a global community improve care for our population. So that's the goal. It's more an informative sessions. We don't teach people nothing. We just share our experiences. So with that, uh, tell our listeners about the healthcare landscape in UAE. For example, what is the population? Because a lot of people may not be aware of what is the population of UAE. How is healthcare administered over there? How big are the provider systems over there? What is the healthcare spending? And what has been the trend that you have observed over last 10, 15 years? Uh,
Sure, absolutely. So the UAE healthcare system consists of obviously of three major healthcare, I would say, healthcare verticals. They are definitely interacting together in terms of policies and regulations and whatnot. But the UAE population is around, let's say, 9.5 to 10 million. The split of it into seven emirates. Abu Dhabi is the political hub and the capital of the UAE, with around 2.7 to 3 million people. The Dubai is the commercial hub with around 4.8 million, and the remaining population is spread across five different emirates. So the health system in the UAE is basically um, um, we have Abu Dhabi, which is regulated by the Department of Health as the regulator, and there is the Abu Dhabi Healthcare Services, SAHA, which is the operator of all the public sector facilities in the Emirate of Abu Dhabi. So basically, the public sector controls over 65-70% of the healthcare services, with all the centers of excellence positioned within the public sector. It's a single payer system in Abu Dhabi, meaning that there weren't insurance, a semi-government organization that is actually controlling or having most of the insurance plans issued in the Emirate of Abu Dhabi. In the Emirate of Dubai, the health system is kind of very interesting as well. It's a very private sector driven health system in Dubai. There is a regulator called Dubai Health Authority that looks after all the basically regulation of healthcare outside the free zones. We also have another regulator that looks after the healthcare inside the free zones called the Dubai Healthcare City, but it doesn't run any public sector facilities. Meanwhile, Dubai Health Authority runs around 4 hospitals and 13 primary care centers, in addition to around 15 medical fitness centers. The system in Dubai is it's a very insurance-focused healthcare system. So we have over, I think, 50 different insurance companies and TPAs covering almost 99.999.999 of the actual population of Dubai. So you have to have an insurance plan in the Emirate of Dubai or Abu Dhabi to actually operate or work or live and so on and so forth. So that's mostly the difference between the healthcare ecosystem between Dubai and Abu Dhabi as the biggest health ecosystems in the UAE. There is also the Federal Ministry of Health that oversees the healthcare policies and regulations and coordinates very closely with Dubai Health Authority and Abu Dhabi Department of Health. The Ministry of Health and Prevention, MOHAB, overlooks or oversees all the healthcare across the other 5 emirates. Plus, there are other entities like the Ministry of Public Health, the Ministry of Presidential Affairs that runs a series of hospitals, specialized hospitals, creating centers of excellence in the area of cardiology and orthopedics in the Northern Emirates. You as an investor, or if you want to open up a hospital, you kind of subjected to 3 to 4 different regulators when it comes to licensing of your healthcare facility as well as the healthcare professionals. However, there's a lot of integration that is happening between these regulators. That gives you a bit of an understanding of the landscape in the UAE.
Excellent, thank you. So I have a few questions as you were sharing your experiences and the knowledge. So if I understand correctly, in Abu Dhabi, you have a single payer, whereas in Dubai, you have multi-payers. Is that correct understanding?
Almost, yes. In Abu Dhabi, the biggest healthcare insurance organization is Daman, yes. There are other players in the market in Abu Dhabi, but on a smaller scale. But yes, it's almost a single payer in Abu Dhabi.
Like in Canada, we have a single payer, which is, the provincial health agency. So every citizen of Canada is covered by every citizen of Ontario. Let me use this thing, because people get confused by single payer, because every province, which is like a state in US, it has its own health agency, and they administer health within that province. So in Ontario, where I'm a resident of, we have Ontario Health Insurance Program. So all residents of Ontario are covered under OHIP. So I don't have a competing insurance agency that I can buy insurance. Now I can buy supplementary insurance, which is to upgrade certain things. Like if I'm going to a hospital, I want a private room versus a room with 2 people or 4 people, depending on what is available. Then I have to pay a little extra. But services-wise, there is no distinction. There is no private clinic that I can go and say, okay, that private clinic will say, I will only take private insurance. Everybody will go in the same queue, will be treated with the same wait time. There is no preferential treatment for patient A versus patient B. Is that true in UAE as well?
So in the UAE, again, There are multiple players in the insurance health market or the healthcare insurance market. The biggest player, the overall dominance, comes from the semi-government insurance organization called Oman. There are other, insurance providers like Adnic that actually play specifically based on specific employers. So if your employer is this organization, specifically oil and gas or something, you might actually be tied into a separate insurance payer. But again, predominantly, Daman is the biggest insurance company in the Emirates of Abu Dhabi. The good thing is all UAE citizens in Abu Dhabi come under one insurance coverage program, which is run by the insurance company Daman. And then the international expatriate community would depend on the employer itself, because the mandate is upon the employer to cover all your employees, specifically the expatriates. So if you are an employer of the government or any of the government authorities in the Emirate of Abu Dhabi, you will come under a specific insurance plan that belongs to the semi-government insurance company called Daman. For example, Dubai likewise. Dubai, the portion of the governmental insurance program is somewhat smaller compared to the private sector insurance, because most of the businesses in Dubai is happening with the private sector taking some sort of a lead. And hence the insurance companies that offer insurance plans in the market of Dubai are much bigger, much more diverse. And there is no dominance in one company as opposed to Abu Dhabi.
Okay. So if I understand correctly, it is the employer's responsibility to provide insurance to their employees. And if you are an employee of a government, then the government ends up giving you insurance. But if you are an employee of a private organization, then they will go to the private insurers and get insurance and provide you. Okay. So it's a nice hybrid. Okay. So let's talk about moving along to the next item that I had. What do you see as the major challenges? I know we are going through this pandemic, so ignore COVID for now. But outside of COVID, what are the major challenges that the health system in UAE is encountering? Now, for example, in Canada, we have 3 or 4 big challenges. We have aging population. That's number one. Our wait times are very long these days. That's a second issue. And we have shortage of providers, doctors, nurses, other ancillary clinicians. We are having these 3, if I have to mark 3 big challenges, those are. And then the cost of healthcare as a whole is going up. So those, to me, are the biggest challenges that are impacting us. So we have to find solutions to these challenges quickly. So what are the challenges on your side?
Sure. So the cost of healthcare is always number one challenge, right? The rising cost of healthcare, number one. Even though there are obviously 3.3% of the GDP is spent on healthcare in the UAE, maybe there is room to actually spend a little bit more. However, the expenditure is actually growing. So optimization, the need for optimization and waste removal is there. Number 2 is actually workforce, specifically local workforce. I mean, again, a very important imperative is to expand the healthcare workforce enablement and development in the region, because most of the workforce actually in the UAE come from international source countries, right? Whether it's from the West or the East. We are now, with the pandemic, we're realizing the importance of bringing medical education to the extent of being able to fill in the gap locally from the citizens and the residents alike. That's number 2 challenge, which is again one of the biggest pain points or initiatives that needs to be addressed. Number 3, obviously, the need for automation and integration. The silos, as you have it in Canada, where each province has a healthcare agency, has created a lot of process silos. And here in the UAE, each state or each emirate has its own healthcare ecosystem. And obviously, for example, if you're a physician in the UAE, you would require to obtain a license in each and every jurisdiction to practice. Again, the need for integration, the need to eliminate silos and integrate more is always number 3 top priority. So digitize everywhere, specifically areas from looking at electronic medical record work that has been done. And there's a lot of great work that has been done in the Emirate of Abu Dhabi, where they have digitized all the public sector facilities in Abu Dhabi. Dubai Health Authority has done the same, and now trying to create an integrated health information exchange, as well as the Northern Emirates. So there are multiple programs that have come to digitize the public sector. The next part is to integrate the public sector with the private sector digitally. And this is one of the biggest initiatives. So creating integration hubs and eliminating silos. That's the third. So these are the top 3 I can think of, from the rising cost to the lack of workforce within the localities, to the silos and the need for integration.
Absolutely. I think the number 1 and 3 are interconnected, because more integration you do, less waste is there in the system. Because what we all have experienced, that if healthcare systems are not integrated between providers, then if you go to provider A and then you go to provider B, then the provider B, given we are in the world of evidence-based medicine, they will run the same test on you, which is causing more waste of resources. As well as by integrating, you can provide care to patients in a lower cost setting rather than in an acute care setting. So, and third, I believe by integrating healthcare, knowing what the population health is like, you can keep them healthy, right? So, for example, if I'm a diabetic and you know what my sugar levels are, and if I'm taking those tests, if that Internet of Things is communicating directly with my health record system, and that health record system is being communicated and managed by like a network command center, like we used to have in big IT firms, where they see alerts and they say, okay, I need to talk to this patient. Their glucose levels have gone up over a period of days. What are they not doing? Are they not taking the meds? Are they not exercising? Whatnot? So we can do more proactive and preemptive care for our patients to keep them healthy and out of health systems.
That is it for today. We will continue our conversation with Dr. Ghadir in our next episode.
Thank you for listening. Let's go out and break barriers and generate new possibilities. Please be sure to visit our website at cjdevgan.com. And if you like our show, please subscribe, leave a rating and a review for us on iTunes.